Hi everybody, thanks for being here with me again this week. Let's talk about low back pain and breathing today. Low back pain because I constantly see people who are suffering of low back pain, and by default I learned a lot about back pain, which gave me great tools to help a lot of people get rid of their pain and be able to enjoy their sports, their life with no pain at all. So in my late 20s, I started having a lot of low back pain, and I had severe episodes of back spasm, sciatica nerve pain that I could barely walk. And learning a lot about corrective exercise, proper corrective stretching, and just breathing has helped me tremendously to actually have a life pain-free, being able to run again, doing half marathons and finish 13 miles running and have no back pain. So that's why I'm so passionate about this subject and passionate about helping people to live a life with no pain, because a life with no pain, it's a life with more energy for you to pursue your dreams. So breathing. So I call breathing, or more specifically diaphragmatic breathing, which let's use an easy word as belly breath. Belly breath is the most fundamental core exercise. So we need to talk about core because, if you tell anybody that you have low back pain, even if they're not an expert, they're gonna say, wow, you have a weak core, you need to do more core exercises. And that might be truth. But if you're doing core exercises with, fault breathing pattern or faulty posture pattern, and you keep doing core exercises and you're not breathing properly, you're not going to train your body actually to use your core muscles properly, and most likely you might not get rid of your low back pain. So two fundamental things need to happen in order for you to get rid of your low back pain or decrease low back pain. And I'm going to just talk about structural problems here today: bones, ligaments, and muscles. There are a lot of other issues that can be causing low back pain, but we're going to stick with structural problems today. So two major causes might lead to back pain: poor alignment of the body. So simply, if you stand around like this with your shoulders rounded, tight chest, that can lead to back problems and actually to other problems in your body, but that can lead to back pain. And second, if you're not breathing properly, that can lead to low back pain as well. Because let's start thinking that low back pain is not a back problem. So if it's not a back problem, it's whose problem? So we start with the breathing, because when you're breathing, you have a lot of muscles involved. And one of the major muscles involved when you're breathing is your diaphragm, that pushes everything up and down and creates internal pressure in your trunk. So if you're not breathing properly, you most likely not having proper internal pressure in your trunk that helps to stabilize the low back spine. So think about breathing over 2,500 times a day. That's the number of times we're breathing normally. I'm not considering exercise or anything, just to function. 2,500 times plus a day. So if you're using muscles like your chest, your shoulders, and your neck in order to breathe, which we call accessory muscles, you are a shallow breather or a chest breather, you actually not working your diaphragm at all. You actually creating a core dysfunction or a core weakness that can be leading to your low back pain. So how do you know if you're breathing properly or not? I'm going to show very quickly here. Place your hand on your chest, one on your belly, and take a deep breath. When you take a deep breath, is your belly expanding? It's your belly pushing your hand out, or when you take a deep breath, you actually sucking your belly in and you elevating your chest. If that's how you're breathing, you have what we call reverse breathing pattern. The proper way to breathe is to inhale your belly should be expanding, and I'm exaggerating here for you, your belly should be expanding. 70% of my inhalation is going through my belly first, and then the 30% is going to my chest, causing my chest and my rib cage to expand. That's a proper breathing. So when you don't have this pattern, the belly breathing pattern dial, and you just use your accessory muscles, you start creating a lot of dysfunction in the trunk muscles. You create constriction on the chest, especially if you work on the computer like most people work these days. You're doing a lot of work, with your shoulders around like this. You increasing that restriction, on your chest, on your ribs, on your shoulders, and that will start affecting your ability to breathe properly and to also have optimal alignment on your body. So you can see here that if you're not breathing properly, you might not just have low back issues. You might have pelvic, hips issues, shoulder impingement, neck pain, upper back pain, and headaches, and so on. And all those things will affect your energy. So how do we retrain our bodies to breathe properly? And just a quick illustration here. If you have a baby, a newborn baby at home, or you spend time with somebody who has a baby, watch the baby breathing. That baby has a perfect diaphragmatic breathing pattern, and we all were born breathing properly. And it's because of stressors in life, physical, emotional, spiritual, mental, that we actually start reverse. We're going to a surviving mode. We go into that fight flight, and we reverse our breathing pattern without even knowing. That's why if you're one of my clients, or if you work with any high skilled PT or a Czech practitioner, the first evaluation we do in our clients is a postural assessment. But with that postural assessment, we assess their breathing. Because again, it is not just the most fundamental core exercise, in my opinion, but the most fundamental exercise that you need to master in order to master all the exercise, because your breathing is involving everything you do, and especially as you move towards more technical or heavy weightlifting, more complex weightlifting movements, because you want to create a fit, ripped body, you need to master breathing. If you're lifting weights with an improper breathing pattern, most likely you're going to cause an injury in your body, and you might already be experiencing low back pain, or again pain in other areas of your back or neck, or have a shoulder impingement. So reverse your breathing by simply placing your hand on your chest and on your hand. So I'm going to show you how to train yourself to do a proper breathing. You inhale and let your belly expand first. So push, exaggerate that so you can really feel those muscles. Exaggerate that inhalation and exaggerate that exhalation. Basically, when you contract your core, or you are exaggerating your exhalation. So when you blow out the air and your core, your belly goes in, you create a great bracing mechanism around your lumbar spine that'll help you to lift heavy objects. So you don't need to exaggerate this exhalation, unless you're lifting something very heavy. And we'll get more into breathing and weightlifting in the future blogs. But today I just want to get your attention. If you suffer low back pain, check your breathing and see what's happening there. And that's the first exercise you want to master. If you have a hard time accessing these muscles, or actually getting your belly to expand, which, believe it or not, a lot of clients have hard time doing this simple exercise, don't panic. You start this exercise actually laying down on the floor, which will eliminate gravity to just keep you up straight. Start on the floor with your knees bent. Place one hand in your belly, because touching your skin, touch your belly, is going to help to stimulate those muscles to work. One hand on the chest, and then remember, 70% of your breath in your belly, 30% in your chest. And that's going to start to activate and strengthen the diaphragm, which is a very important muscle for core function and core strength. And the last thing I want to show you before I let you go is one of my favorite mobilizers. Mobilizers an exercise that will create freedom from my joints, my muscles to move better. So if you have a ball in the office at home, simply lay on the ball and lay on the ball and relax all your muscles. What this is doing, it's creating more mobility or better movement around my rib cage. Because remember, if you have constriction on the chest, will most likely create constriction, tightness around your ribs. If your ribs cannot expand when you breathe, it's going to cause a poor breathing pattern, and you want to be able to move. So remember, belly needs to expand, your rib cage needs to expand sideways, your chest will expand in every single angle, and that will naturally increase your posture, which your low back would be very grateful. So breathe deeply, take breaks through the day, stretch on the ball, stand up straight, and have a proper core program that starts from belly breathing, and that way you can have a life with no back pain. So if you enjoyed this video, please share with your friends and family. Help me to help more people. I'm sure you have friends and family, somebody in your life that might be experiencing low back pain that could truly benefit from this video. And if you want to know more details about my breathing and posture assessments, please contact me, and I'll be happy to teach you how to breathe properly and have a healthier and happier life. Thank you so much. Look forward to see you next week.